you know what we're going to do today. Hi, this is Nurse Cecile and welcome back to my channel.
This video is solely for demonstration purposes as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden Manual of Clinical Nursing Procedure 10th edition. All information presented are public domain materials accessible through the relevant governing organization's websites. Subtle similitude may be noticeable, however, this is not intended to be definitive guide to the NMC Part 2 Test of Competence or the OSCE examination. This can be a helpful material for overseas or internationally trained nurses to learn and adapt to the UK clinical settings and transition effectively into practice.
In the NMC OSCE exam, the candidate needs to demonstrate injection skills, whether subcutaneous injection or intramuscular injection. And yes, today I am going to show you how to do a subcutaneous injection. So you have to do this skill within 12 minutes. Nurses, always remember, in this station,
Ensure to safely administer the medication.
and since it's administering of medication, again, like I always say, if you are to administer a medication, remember your 5 R's. Those are right patient, right medication, right route, right time, and right dose. Remember these 5 R's, nurses. This also includes the checking of the prescription against the patient's ID or ID wristband. Also, when giving medication, documentation is vital. This chart should be dated, timed, and signed.
If any of the aforementioned is missed,
This should result into a fail. So we don't want that, nurses, do we? But before we get into it, please give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more videos, then hit the notification bell. Oh yeah, comment down below what other OSCE videos you want me to do. Alright, are you ready, nurses? Let's go! So the first thing I'm going to do is to gel my hands before approaching the patient. 5 backward and forward stroke, palm to palm. Right palm on the left torso and vice versa. Fingers interlace. Back of the fingers interlock. Rotation around of the thumb. Rotation around the finger clasp. And rotation around of the wrist. Let it dry for 30 seconds. Hi, I'm Nurse Cecile and I'm going to be your nurse for today.
Hi, Nurse Cecile.
How are you?
I'm okay.
Good. So I'm here today because I need to give you your subcutaneous injection. You're due with your insulin Levemir, so that's what I need to give you. If that's all right with you?
Yep.
Okay. Would it be okay if I just do an identification check? Can you tell me your full name, please?
Lylene Consi,
Okay, Lylene Consi, according to my prescription. Can you tell me your date of birth?
10 of the 1st, 1987.
Okay, 10 of the 1st, 1987. And your address, please?
1000 Edinburgh Avenue. NR 317HA.
Okay, can you tell me, do you have any allergies to medication, food, and latex?
I'm allergic to penicillin.
Penicillin, okay? According to this, according to your prescription, you're allergic to penicillin. Can you just tell me the allergic reaction that you get from penicillin?
I got rashes.
Rashes. I'll make sure that I won't give any penicillin derivative, okay?
Okay.
What do you want me to call you, by the way?
Just call me Lylene.
Okay, Lylene. Are you comfortable right now? Do you have any pain at all?
I'm not in pain at the moment.
Okay, are you comfortable sitting like that?
Yes.
Okay, so like I said a while ago, you're due for your insulin, and according to your prescription, your blood glucose level is 7.9 millimoles per liter. Is that right?
Yeah.
Okay, so I need to give you your injection, okay, of insulin. Is that okay?
Yes, thank you.
So the due is now, which is 8 in the morning. I just need to prepare it on that side. If you need me, please don't hesitate to call, okay?
Alright, thank you.
Alright, before leaving the patient, I'm just gonna gel my hands again and let it dry for 30 seconds afterwards. Let it dry for 30 seconds. So I'm gonna prepare now the equipment that I needed. So before preparing the articles that we needed, I need to do the hand washing, okay? So I'm gonna wet my hands. Get some soap. with 5 backward and forward stroke from palm to palm. Right palm over the left torso and vice versa. Fingers interlaced. Fingers interlocked. Rotational rubbing of the thumb and vice versa. Rotational rubbing of your finger clasp and rotational rubbing of the wrist. Rinse it thoroughly with water and then pat it dry with clean towels. Dispose it in the domestic bin. Pat it dry. And again, there you go. That's how you wash your hands using the 6 steps of hand washing according to the World Health Organization. Oh yeah, now that I've washed my hands, I just need first to read the prescription. Just like any other administration of medication, you have to read the prescription first. So the prescription says you are visiting a new patient at home who requires medication, insulin levemir injection. Patient's blood glucose level is 7.5 millimoles per liter. It is today and it's 8 in the morning. So the name of the patient is Miss Lylene Concy. Address is 1000 Edinburgh Avenue.
Date of birth, 10th of the 1st, 1987. She's allergic to penicillin. Her reaction for that is rashes. So the drug name is insulin levemir. Dose, route, and frequency. She's got 15 units, subcutaneous once a day. Name and signature of the doctor is there, Dr. Jean Gray, and the date is today.
Miss Examiner, are we going to use a disposable tray?
Yes, that one is disposable and you can use it.
Okay, so I get here my disposable tray. So the next one I'm gonna get is the insulin itself. So I've got here the insulin levemir. This is the solution for injection. Insulin levemir 100 IU per ml solution for injection. Insulin human sub-Q. Okay, expiration date is 3rd of 2025. So it's within expiry and there's no particulate. And I need to compare it with the prescription. I'm gonna put it on my tray. The next one is the insulin syringe. So I've got here my insulin syringe. It's clean and intact. The expiration date 31st of the 8th, 2027. Put it in my tray. The next one is the alcohol swab. So I'm gonna get 2. So I got here the Clinel wipes, Clinel swab, chlorhexidine, 70% alcohol, clean and intact. Expiration date is 9th of 2023. I'll get 2. My gloves. And the prescription itself. I'm just gonna wear my apron. There you go. Okay, so before going to the patient, I just need to prepare the medication first. So let me just gel my hands. Let it dry for 30 seconds. So first things first, I'll wear my gloves. Okay, the syringe, insulin syringe. Open the packet. So the first thing is to clean the rubber septum of vial using alcohol wipe and dry it for 30 seconds. So after cleaning the rubber septum, I just need to wait for 30 seconds for it to dry. Once it's dry, I'm gonna withdraw the required amount, which is 15 units, okay? So I got the 15 units. I have to resheet this one using a 1-scoop technique as per Royal Marsden, okay? So I'm gonna remove now the packaging. There you go.
Remove my gloves.
Then let it dry for 30 seconds. I'm just gonna get another pair of gloves. As you've noticed, I didn't do a double checking with the medication because we are in the community setting, okay? It's not gonna be necessary and the examiner will tell that to you even before you start this procedure. But if you are in the hospital setting, you have to ask another registered nurse to check if the amount that you've withdrawn is correct. So I'm ready to go now to the patient side. Hi again, Lailene. I'm here now to give you your injection, if that's all right with you.
Okay.
Okay, so again, before I proceed, I'm gonna provide privacy and dignity to the patient, making sure that the windows or the curtains are closed or the door as well, okay? So let me just gel my hands. And let it dry for 30 seconds. So let me just wear my gloves. Alright, Lailene. So again, here's the injection. But before anything else, would it be okay if I just check your ID again?
Okay.
Okay, so can you please tell me your full name, please?
Lailene Consi.
Lailene Consi. And your date of birth?
10 of the 1st, 1987.
Okay, 10 of the 1st. Can you tell me your address first?
1000 Edinburgh Avenue, NR 317HA.
Okay, and you said you have allergies to
Penicillin.
penicillin, yeah? Reaction for that
Rashes.
one? Rashes, okay? I can confirm that again, this is the same patient. Okay, thank you so much for that. Lailene, when was the last time you had your insulin?
I had it yesterday.
Where did you had it done?
I had it on my right arm.
Right arm, okay. So basically, you can have it in your arm or in your thigh, or you can have it here. Most commonly, they have it in their abdomen, if that's alright with you.
Can you inject it to my arm again?
Okay,
to the left one?
To the left, okay. I'll do that, okay? Would it be okay if I expose your arm?
Yeah, okay, sure.
But before I expose your arm, are you comfortable?
I am comfortable.
Do you have
nurse.
any pain at all?
I'm not in pain.
Okay, you mentioned that you've got no pain, so meaning 0 to 10, 0 no pain and being the worst, that's 0. Can you confirm it?
Yes.
Okay, so let me just expose it, yeah? Would it be okay?
Okay.
Lailene, would it be okay if I put up your sleeve to expose the injection site?
Yeah, sure.
Okay. Alright, I can see that the injection site is clean. There's no signs of inflammation, rashes, edema, infection, or any skin lesions, okay? So I can see that the injection site is visibly clean. Basically, if the injection site is clean, so no need to clean it unless otherwise cleaning is required. I just need to show it to you in this procedure, okay? I'm gonna clean the injection site with chlorhexidine, okay? 70% alcohol. So, again, get the swab.
Clean it with single stroke from top to bottom.
Or, you can do it from the center, from inner to outer. And let it dry for 30 seconds. Wait to the clinical waste bin. Since I'm using a hard mannequin, so I'm gonna use a sponge for you to see how it's done, okay? Imagine that this is the patient's arm, alright? Okay, I'm gonna use my non-dominant hand to pinch the skin. There you go. Once I pinch the skin, I'm not allowed to remove it unless otherwise the needle is already inside, okay? Alright? Remember that. That's the difference between the IM. So we're doing sub-Q. Again, pinch it and leave it there, okay? Now, I'm gonna take the insulin syringe. I'll hold it like a dart and make sure to inform the patient at the same time. I'm gonna give it to you now. Sharp scratch. Holding it like a dart. 90-degree angle. Okay, sharp scratch. nurses, remember this, when you are giving insulin, it has to be 90-degree angle, okay? But if it's any other medication apart from insulin, then it has to be 45-degree angle, okay? Because it's subcutaneous. The only exception is the insulin, okay? I'm gonna release the pinch, and I need to depress the plunger for 10 to 30 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now I need to wait for 10 seconds for the medication to be diffused into the surrounding tissue, okay? 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. So I rapidly remove the needle. Gently apply a pressure on the side, okay? So at this time, I'm gonna use a gauze. Don't worry, normally if we are giving insulin, there's no bleeding in there, okay? If you found any gauze in the station where you are doing your exam, then get it, okay? Make sure to not forget to check the expiry date. If not, then you don't have to worry. Just advise the patient to apply gentle pressure, but make sure to do not massage the area to avoid the risk of tissue damage, okay? Now for this insulin syringe, I need to apply the safety mechanism, which is like this. There you go. It's now safe. So I will put this directly into the sharps bin, okay? Okay, if you also have plaster on the provided during your exam, you can put it after the injection, okay, to prevent bleeding. But normally, really, most of the time they don't. Okay, so now I have disposed the sharps, and I'm gonna dispose the non-sharp to the clinical waste bin. Okay. Okay. Now I'm gonna put back the sleeves down. Are you comfortable, Eileen?
I am comfortable.
Okay. So are you in any pain at all?
I'm not in pain.
Okay, so thank you so much. We are done with the injection. Let me just document it if that's all right with you.
All right, thank you, nurse.
Okay. So now I'm gonna remove my gloves and apron and put it in the clinical waste bin. Then I'm gonna gel my hands. Let it dry for 30 seconds. So as you've noticed, I still have my medication inside the tray because there's a reason why I left it there, and I will reveal it to you later, okay? So now I just need to document. So the reason why I left the medication here in my tray, because I need to get the batch number and document it, okay? So at the moment, I get here the batch number. As you can see, I have labeled the vial, okay, from when I opened it, okay? But you can just, I think in the exam, you can just verbalize it, okay? And then verbalize that I'm gonna put this vial back to the fridge. Since this tray is disposable, I'm gonna dispose it in the clinical waste bin. Gel my hands. And then let it dry for 30 seconds, okay? We are now done with your medication. So the thing is, I'll stay here for the next 15 minutes to check if there's any adverse reaction. But if I'm not here anymore, and if you have some queries, please call the GP or your district nurse or your community nurse, or if there's any emergency, then call 999, okay?
Alright, thank you very much, nurse.
Okay, like I said, if you need me, I'm still gonna be here for 15 minutes. Thank you so much for today. Are you comfortable?
I am comfortable, nurse, yes.
Okay, do you have any pain at all?
I'm not in pain.
Any
Thank
question
you.
for me?
No question.
Okay.
Thank you. Thank you.
Alright, thank you so much for today. I'm gonna remove the privacy that I provided a while ago. So open the door, open the windows and the curtains, okay? Making sure that the patient is comfortable. So I'm gonna gel my hands and then I just need to let it dry for 30 seconds afterwards. And then making sure that I wash my hands after the procedure. And that's the end of your subcutaneous injection station. So I hope you learned something for today, and if you like this video, give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more videos, then hit the notification bell. This has been Nurse Cecile. See you on the next one. Bye!